One of the best gifts you can give your kids and grandkids is to make sure you're here for a long time to come, and that means taking care of your heart. Dr. Gil Schorlemer from St. Mark's Hospital Valve Clinic wants people to be aware of a common heart disease called aortic stenosis. Thank you so much for being here.
My pleasure.
Well, difficult to say, kind of scary at title. What is it exactly?
Well, aortic stenosis is a narrowing of one of the four valves of the heart that lets the blood out of the heart when it's pumping. And as the narrowing progresses and gets worse and worse, the heart has to work harder and harder to push the blood out. And eventually that leads to heart failure and, as an end stage, to death.
How would someone know if they have aortic stenosis?
Well, there's a number of symptoms that go along. Most people will have a heart murmur or have been told they had a heart murmur at some point in time. When it becomes more severe, there's a decrease in exercise tolerance manifested by breathlessness, chest pain. There can also be problems with syncope or loss of consciousness, as we call it. Occasionally, people will also have severe swelling in their extremities in relationship to heart failure.
Once you've identified the problem, how is it treated?
Well, treatment involves three major modalities. Early on with stenosis, medical management's appropriate. When it becomes more severe, then a surgical approach is necessary. In the past, we had a number of patients who really weren't candidates for surgery, and this new technique allows them to have an option for treatment as well, because it's very clear that as the valve disease worsens, if it's not treated, the end result is quite poor. It's very important to be evaluated in a multidisciplinary technique where we have at the St. Mark's Valve Clinic a cardiac surgeon and a cardiologist and an echocardiographer who all see the patient together. And we feel like that is very helpful because then the patient gets one recommendation for care from all of these specialists.
We're looking at a very impressive animation of the surgery. Talk me through this, if you will. What is happening and how does it help?
Well, the valve is diseased and narrowed, and the initial part of the process involves using a balloon catheter to open the valve up, the native valve up. The prosthesis, the transcatheter valve, is mounted on the balloon and crimped tightly. It's passed through the opened valve and then deployed as you see the balloon doing here. It pushes the old valve out of the way and creates a new wide open passage. And the result is nothing short of spectacular. In person, I can tell you, having done this for many years, it is amazing, truly amazing.
Well, it's incredible just to watch that demonstration. I can't imagine being part of the actual process. How do patients feel after the procedure? It's
actually very dramatic. Having done many open procedures, you know, you're used to people having a lot of pain and you know, a big recovery period. Most of these patients have minimal to no pain. They experience a marked improvement in their breathing right away. And there's sort of an overall sense of well-being. It's very dramatic sometimes when you see a patient who was gray in your office and they're nice and pink and alive just from you know, immediate relief of the aortic stenosis.
I think it's obvious to see the benefit of that team approach you were talking about that St. Mark's offers their patients. If people want more information, maybe they're considering this procedure for themselves or want to be checked out, check the condition of their heart health, how do they get in touch with you?
Well, the website MountainStarHealth.com is an excellent resource, also specific to St. Mark's and the Valve Clinic. The stmarkshospital.com website's an important place to get information from. Certainly St. Mark's is one of the top 50 cardiovascular hospitals in the country. We're very honored for that. We also have the only accredited chest pain center in the state. So we really believe that it's the place to come if you have heart disease.
You're in good hands there. Thank you so much for a peek inside that medical procedure. It's always fascinating to see, Dr. Schorlemer. We appreciate it.
Thank you so much for having me.